So if you look at what they call therapeutic strategies for therapeutic education, there are two things you must take into consideration. The first thing, therapy. Therapeutic means treatment. How do you accompany the patient in such a way that what you give, the patient would, one, accept it, have the knowledge to accept it, two, have the label to follow it, and three, be able to follow up themselves to know that it's working. So in medicine, especially with chronic diseases of lifestyle like diabetes, high blood pressure, these are chronic diseases of lifestyle. Because when you have these diseases, they try telling you, don't eat this, don't drink these drinks. So we bring in a package where we accompany the patient with knowledge. We accompany the patient with tools that they can use for psychosocial makeup. And we give them tools that they'll be able to assess their management skills. In diabetes, it means measuring your blood glucose. And it's this package that we say therapeutic education, because this education is between the doctor and the patient, the doctor empowering the patient to be able to take care of their disease when the doctor is not there. And for the patient to be able to do that, you need all these tools that would enable them to have a successful outcome. Two types of tools, those related to the treatment of the disease and those related to follow up. And the treatment is to prevent them from having complications of the disease. The priority area of research is the pharmacopoeia, the local pharmacopoeia. What do our traditional doctors have that we can use to manage people with diabetes? So that's a big area of research. We must develop our national pharmacopoeia. The second area of research, which is extremely important, how do patients behave when they have diabetes? What factors prevent them from obeying the therapeutic education or management? And the third one is, how can we prevent complications in patients who already have the disease? And how can we prevent people who have the risk factors and they can develop the disease? These are broad areas that we have to develop in order to understand why people have diabetes and what can be done to prevent them from developing complications. These are important aspects, and unless we do this, only the cost of management of diabetes will be beyond our means, because we don't have a national health system, insurance-free medication. So we need to develop measures and do research onto how we can manage these patients. Hypertension is the same thing. The high blood pressure is due to, they have the same common risk factors as you heard today. You had today obesity, salt intake, alcohol intake, smoking. Those are common risk factors for diabetes and high blood pressure. If somebody who has hypertensive, continuous smoking, would have cardiac complications, would have heart complications. Therefore, what you do is that you apply the same principle, 5 risk factors for 5 diseases, including mental health. Oh yes, I've done so many PhD theses with our medicinal plants. The African pharmacopoeia, the plants, the leaves, and they bring down the blood sugar. What we have to do is, how do we commercialize that to make it productive? I said a while ago that most of the drugs you hear, the oral tablets, come from leaves and from plants. So in order to do, we must develop what are the side effects, what is the composite of what makes it work, what can complicate the filing, and then we can put them now in tablet form, in liquid form. But we go there and we don't have the source, because after which they have to go 10 kilometers into the bush to look for the plant, but we can grow them. We can grow these same plants and start producing them industrially and having production of tablets from those plants. Aspirin is from plant, quinquina, plant. So most medications are from plants, and we have the plants. And I have the experience in terms of the PhD students who have used African plants in order to do the scientific workout to see that they develop the work on diabetes and prevent complications.